Not an uncommon question is, should I wait to have surgery or is it better to have surgery while I'm young? So that's a very interesting question because it is really different depending on what we're talking about. And so maybe you have this really big bunion that is painful and you know you need to have surgery on it eventually, but you're just inevitably putting it off. Well, in that situation, I'd say yes. If we know we're going to be in a surgical situation, then let's go ahead and get this done with so you can enjoy the years that you have. Anytime that we can opt for a surgery at a younger age, we have better healing potential and a decreased risk of complications. Now, on the flip side, maybe you have something that you're not really confident that you want surgery or that you need surgery. So in those situations, let's say it's a bunion again, but it's not painful. You know it's just there. You know your mom had one and complained about it in her later years. Should you just go ahead and get it fixed now? In those situations, I don't necessarily think it's better to hurry up and fix that bunion before it becomes painful, because not every bunion becomes painful. And so depending on how large it is and your activity level and maybe the progression that your mom had, we had to take all of those factors into place. And I wouldn't necessarily put a blanket point out there and saying you should have surgery while you're younger versus when you're older, because sometimes surgery can be avoided. And obviously, if that's a possibility, that would be my approach. So if you're in that in-between place and you're not really sure what to do, go ahead and come in and we can take some x-rays, we can walk through your deformity, we can talk about your family history, we can talk about your activity and your expectations, and we'll help you figure out a timeline about what to do about your stinking foot.